Aly-Khan Satchu joins us now from Nairobi. He's an economic analyst and CEO of Rich Management. Thanks so much for speaking to us. First of all, to say between 300,000 and 3.3 million could die, that's not much of an estimate. I just have to ask if you have an expectation yourself for how bad it could be.
So, we've had about three expectations. Bill Gates threw out a number of 10 million, the WHO 2 million, then we've got this range. What we know about the COVID is basically it's non-linear, it's multiplicative, and it's exponential. So although the numbers look low at the moment, around 17,000, I don't think we're capturing all, we're not testing everybody. So my estimate really is also a wide range, but I would say there's the possibility of being even more than that prediction of Bill Gates, simply because density in our cities, lack of healthcare, very quick to put pressure on the healthcare system. So it's very, very worrying at the moment from a healthcare perspective and also from an economic perspective as well.
Right. I just have to ask you, being in Africa, you know how adversely affected Africa is by various diseases, not least tuberculosis and malaria. Do you really expect COVID-19 to be worse than those two diseases?
So that's a really interesting point, and I think that speaks to the comorbidity problem here, particularly in places like South Africa, where you have a lot of AIDS and tuberculosis, Botswana as well. And I think that's why you've seen those two countries in particular take a very, very hard stance on locking everybody down. The nature of a virus is it can go from 1 to 100. The statistics show that once you get to 100 with COVID, you're growing at 35% a day without interventions. So the problem with it is it's so multiplicative. That's what confuses a lot of people, and that's why you get that silly argument, it's not worse than the flu. It's not. If you take a snapshot now, but 17,000 can become 1 million very, very quickly, and 10 million. So yes, I think if you're modeling it from a mathematical point of view, definitely, it could be far worse.
Okay. The United Nations, you were talking about the economic impact. It's horrendous all over the world. But the United Nations actually put out a report just yesterday that said lockdowns and the subsequent economic slowdown are actually expected now to cause the deaths of hundreds of thousands of children, particularly in developing countries. Because, for example, they won't be getting fed at school. That was, for many children, their only source of healthy food. Aid to camps and informal settlements will be slowed. It's almost like I said before that when it comes to children especially, the prevention could actually be worse than the disease.
So that's another very valid point you're making. Firstly, look, the continent's very young in comparison to any other place in the world. So we've got a lot of young people in Africa. And the problem you're referring to is, the lockdown, people can't make a living. Who's going to suffer in those situations? Our children, already typically with very poor nutrition, underfed in many parts, take South Sudan. It doesn't have any it has 2 ventilators and 5 vice presidents. So this is a perfect storm for the continent. And of course, at a time when everybody's looking at their own situation and it's not that great, one worries that everyone's going to forget about the continent. And the continent is fully borrowed. There's no money available. Income is going to go right down. Remittances are down 80%. The governments don't have the wherewithal to deal with the problem. And that's the other problem, I'm afraid.
Right. Is there a way, though, to get Africa the funding and resources it needs then to fight this pandemic without plunging it further into economic ruin?
So it's an interesting question. The IMF, the World Bank, President Ramaphosa's put a team together with TGM, the ex-Credit Suisse CEO, lobbying international creditors, including China, including private creditors, to relax and maybe give us a debt moratorium and give some breathing space. What's happened on the continent was this enormous infrastructure splurge, zero return on investment for the foreseeable future, huge borrowing in the Eurobond markets, over $100 billion, which are all trading at distressed levels already. So it really is a triple whammy. Throw in the locusts as well in East Africa, and you really could not imagine such a situation all happening at the same time. So, but I think the international creditors are looking to give Africa some breathing space. But you know, the problem here is firstly, it's a medical emergency. You've got to look after people first. Once you do that, then you can look at the economy.
Okay, Aly-Khan Satchu, thanks so much for joining us there. We've greatly appreciated it.